Hi everybody, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India. Are you suffering from shoulder pain? Do you feel your shoulder is stiff and you can't move it much? Or do you feel weak in your shoulder? So what could be the reasons for this? Number one, if you feel stiff, if there's constant pain, and that pain has been increasing over a period of time, you've had no injury, etc., it's just started on its own, it could be a frozen shoulder. The best sign is, see if you can touch your back. See if you can rotate your arm outwards. If you can't do that, most likely to be a frozen shoulder. No injury, even more likely. Check your blood sugars. You're diabetic, there's a 7 on 10 chance that you may have a frozen shoulder. Second, a rotator cuff injury. You were playing something, lifting a suitcase out of the shelf, out of an aircraft. Suddenly you had pain, you couldn't lift your arm on your own. It could be that the ropes in your shoulder that basically help you move your shoulder are torn. What are these ropes? These are tendons. What are tendons? Tendons are ropes that connect a muscle to a bone. These tendons are continuation of your shoulder muscles that come from behind your back and attach onto the ball of the shoulder. These tendons can tear. These tendons can get swollen. When they get swollen, they touch against the bone on top, which is the acromion. That can cause something called impingement. How do you figure that out? You figure that out when you're not able to reach out things on top. There's a sharp pain. Could be that. So it could be impingement. If you can't lift your arm on your own, but with the other arm, could be a rotator cuff tear. Both these, more often than not, happen because of injury. If you've fallen down, sudden pain, a lot of swelling, not able to move the arm, could be a fracture for all you know. If you feel you've fallen down, you feel that something came out. You feel that the shoulder doesn't look the same. There's a lot of swelling, not able to move your arm. Could be a dislocation also. So these are relatively common problems that can lead to pain in the shoulder, stiffness in the shoulder. And this is how you recognize them. So what do? Go to a specialist like me. Get yourself evaluated by them. They may get an X-ray done initially to see whether there's any bony injury. If not, they may advise you an MRI and ultrasound to see whether you've broken any ligaments, any tendons inside your shoulder, which could have led to these problems, and then eventually may suggest treatment to you. In a frozen shoulder, best form of treatment is physical therapy, which is physiotherapy. So a physiotherapist is somebody that gets you back to normal. Usually when surgery is not an option, or when you know that it's a self-limiting problem. That means the problem ends itself and becomes okay on its own, like a frozen shoulder. Physical therapy helps you get back earlier, so it may just be the solution. If there's something broken inside, a tendon, a ligament, you've had a dislocation, a fracture, you may need surgery. Surgery, more often than not, is done through keyhole surgery. That means you put in a little telescope through a small little incision. You see the shoulder, repair these tendons, repair these ligaments, etc., get them back in place. If there's a fracture, you may need open surgery, wherein you open that part, fix the fracture bones together. Some of the shoulder fractures have a great propensity to heal on their own, so you may be just given a shoulder immobilizer to keep in place and wait for an invariable period of time for it to heal. Normally 6 weeks to 3 months depending on your age. Once you've healed, what do? You do something called physiotherapy. Physiotherapy is divided into 2 parts, functional rehab and return to sport rehab. In functional rehab, you're basically looking at getting back to normal activities of daily living, wearing your clothes, eating food, combing your hair, going to work, driving your car, which is usually done in the period between 3 weeks to 6 weeks. The first 3 weeks are basically rest because you want that part to heal. This is especially when you've done a keyhole operation. So rest is very important for things to heal. Then you work on movement and functional rehab. And after 6 weeks, that is 6 weeks to 3 months, is more on return to sport rehab, where there's more of strength and conditioning. Because remember, the part that's been repaired is like the tire of a car. You need to work on the engine also so that the car drives well. The engine are the muscles around your shoulder, so you need to focus on getting back movement and making these muscles strong. Another very important cause of shoulder pain, which you shouldn't neglect because it's normally neglected and more associated with the knee, is arthritis of the shoulder. Now remember, the shoulder joint is a non-weight bearing joint, but the cartilage in the shoulder can also get worn out. What is the cartilage? It is the polish on the bone on top called the humerus, or the ball of the shoulder, and there's a socket, so the polish can get rubbed off over a period of time, leading to arthritis. It looks and feels a lot like a frozen shoulder but doesn't get all right. It's diagnosed normally with X-rays and MRIs, and the treatment is normally initially with physiotherapy, sometimes injections, and eventually something called a shoulder replacement surgery. I hope you've got enough information about causes of pain in the shoulder, causes of weakness in the shoulder, stiffness in the shoulder, how do you treat them. If you like my video, please like and subscribe to my channel, and please follow me on Instagram.